Hi guys, my name is Dr. Fong Lei. Please remember to hit that subscribe button as I'll be giving you guys more information on foot and ankle surgery in the future. All right, today we're going to talk about the new Stryker ProStep MICA Solar System. I got this box dropped off earlier today. It consists of a guide and sawbone. It informs surgeons on what it does and allows you to achieve for minimally invasive bunion surgeries. So it allows you to shift, stabilize, and target appropriately for the parallel guide in your screws to be parallel. Let's take a look at what's inside. So that's what the box looks like inside. Slowly read over that. And these are some tips and statements that allows you to understand what minimally invasive surgery is and what this system achieves and allows you to provide to your patients. Let's take a look at the sawbone that's inside. All right, so take a look here. This is a sawbone model of the Radel system. Of course, a sawbone. This is a Radel type plastic material that is going to be able to be autoclaved and reused over time. This should be in the set, and just ask your local rep to get you the system to allow you to be able to use this reproducible MICA system. All right. As you see, the osteotomy has already been achieved here. So usually with these osteotomies, minimally invasive surgery, you make a small poke hole. Transverse osteotomy, as you see here, goes all the way through and through. We didn't shift it yet, but this guide allows you to stabilize by placing a guide wire through the first metatarsal to the second. This dial allows you to shift that capital fragment. As you see here, there's a hook here made out of that Radel material that goes into the intermedullary canal to shift the metatarsal and push it over accordingly. And these are the parallel guides to allow you to provide reproducible screw placement. All right, let's take a look. So as I turn this dial, you can see I'm shifting the capital fragment more laterally. And depending on the deformity, you can shift it as far as you need to be, but just to the point where you have cortical bone on cortical bone, as you see right there. All right, so that's a really good shift. So once you shift it, you're happy with the shift, you take your guide wire and you go through the guide hole here. And this will allow you to stabilize the capital fragment, first metatarsal, to the second without allowing it to move, migrate while you're placing your parallel guides. As you see here, this is where the parallel guides go. So it goes through here. As it goes through, right up to that area there. So see how that stabilizes it. You'd have an extra wire, of course. That extra wire would go back through this area here. And as you see, they are pretty parallel. So the parallel guide goes right through here. Like I said, the system is radiolucent, so when you're looking on your fluoro machine, which a minimally invasive surgery is very fluoro based, you want to be able to see that you are in the center of your metatarsal. You don't want to be too plantar or dorsal. So once you're happy with that placement, you of course drill, and you can kind of see how far back this guide is, which I really like. This guide allows you to go pretty far near the base of the first metatarsal, and that's where you really need to be in order to get that screw. And as you see, this looks like it's not even in where any bone growth will occur, but over time there will be some bone growth within this area here. This is a healthy shift, of course, for minimally invasive bunion surgery, but once you get the screws across, these patients can weight bear immediately afterwards. You'll have a small stitch here and two small stitches here, and patients will be very happy. So I love the system. I think it's new technology which surgeons love. We want to provide for our patients this reproducible, minimally invasive surgery. I think Stryker came out with an amazing tool and guide for us to achieve this for our patients. So hopefully you guys enjoyed learning a little bit about this new system. Hopefully you were able to use it in the future. And good luck out there. Please continue to follow for additional tips on foot and ankle surgery in the future. All right, take care, guys.